that the people of Iowa, and I think the people of America at this point, know what I stand for. I am in public service because I believe in the American people. I think that that if government is working well, we can knock down barriers to their American dream. The proposals and policies that I've put forward are ones that I've been putting forward for the last 20 years. And there's a consistency there, whether it's in terms of how we deal with the war in Iraq, how we deal with health care, how we deal with making sure that every child in America has the kind of education they deserve. When people look back on their track record, and in fact I think David Brooks in the New York Times wrote about that, they find that I have been consistent in my values and my ideals and the choices I've made in my life to be an organizer or a civil rights lawyer or to be a public servant. People, I think, can have confidence that I am who I say I am.
Do you think these stories have successfully created an unease and uncertainty, a doubt about you?
Well, I think there's no doubt that in the closing days of the campaign, we've seen independent expenditures groups that are providing outside assistance, running some negative ads against us. That may have some effect, but ultimately, I'm putting my faith in the people of Iowa and the people of America that they want something better. And Tim, I think the fact that I'm here in a position to win against people who've been campaigning for longer times and have much more sturdy organizations is a testimony to how badly people want something new. They want something different. And if they've got the courage to bring about those changes in 5 days, I think we can trigger a whole new kind of politics in this country, and we'll chart a new course that will be better for the American people.
In terms of candor, you're running a political ad in Iowa and elsewhere about health care. And this is what the ad says. Here's the Obama ad. Let's watch.
I've got a plan to cut costs and cover everyone.
Cover everyone. Every analysis of your health care plan says there are 15 million Americans who would not be automatically covered because you don't call for a mandate. Let me just give you a chance to respond. Ron Brownstein, who's objective on this, wrote this for the National Journal, and then we'll come back and talk about it. He says this: Obama faces his own contortions. He commendably calls for building a broad health care consensus that includes the insurance industry, but in the states, the individual mandate has been critical in persuading insurers to accept reform, including the requirement they no longer reject applicants with pre-existing health problems. If such a requirement isn't tied to a mandate, insurers correctly note the uninsured can wait until they're sick to buy coverage, which would inflate costs for everyone else. By seeking guaranteed access without an individual mandate, Obama is virtually ensuring war with the insurance companies he's pledged to engage.
Well, Tim, here's the philosophical debate that's going on. First of all, every objective observer says, Edwards, Clinton, myself, we basically have the same plan. We do have a philosophical difference. They both believe that the problem is that government is not forcing adults to get health care. My belief is that the real problem is people can't afford health care, and that if we can make it affordable, they will purchase it. Now, they assert that there are going to be all these people left out who are avoiding buying health care. My attitude is we are going to make sure that we reduce costs for families who don't have health care, but also people who do have health care and are desperately needing some price relief. And we are going to reduce costs by about $2,500 per family. If it turns out that there are still people left over who are not purchasing health care, one way of avoiding them waiting till they get sick is to charge a penalty if they try to sign up later, so that they have an incentive to sign up immediately.
Which is a quasi-mandate.
But, well, no, it's not a quasi-mandate, because what happens then is we are not going around trying to find people who can't afford health care, and that's what's happening in Massachusetts right now. They've already had to exempt 20% of the uninsured, and you're reading stories about people who didn't have health care, still can't afford the premiums on the subsidized health care, but now are also paying a fine. That, I don't think, is providing relief to the American people. We need to make health care affordable. That's what my plan does. And the Washington Post itself said for the Clinton campaign to try to find an individual who wanted health care and could not get it under the Obama administration would be very difficult, because that person probably does not exist. If you want health care under my plan, you will be able to get it. It will be affordable. And it will be of high quality.
Before you go, you related a conversation that you had with your wife, Michelle, that if you didn't win this time for president, you wouldn't run again.
Well, no, what my wife said is, we're not doing this again.
Is she right?
Well, the point she was making, I think, was an interesting one, which is, she said, one of the things that we bring to this race is we're not that far away from normal. You know, it wasn't that long ago that we were living in a small condo and it was getting too small for our kids, that we were trying to figure out how to save money for our children's college education and paying off student loans. That, I think, gives us some insight into what ordinary Americans are going through right now. 8 years from now, she isn't so sure that we won't be in a different orbit and we won't have that same feeling for what people are going through.
But if you don't win this time, would you run again?
Oh, Tim, we haven't even cast we haven't even had the first caucus in Iowa.
Keeping that door open, huh?
I intend to win this time. That's why I'm running.
Senator Obama, thanks very much for joining us and sharing your views.
Thank you.
And we'll be right back.